Great pleasure to ask the team from Lewisham and Greenwich at Ward 3 Queen Elizabeth Hospital. I can see Dr. Grasso, I think, is on the call to present a project which is close to my heart. I'm quite an old junior doctor, and obviously not just junior doctors, but everyone's education has been impacted by the last couple of years. So it's great to see an initiative that values education as part of the ward round. So I'll hand over to the team at Lewisham.
Hi there, can you all hear me well?
We can, yes.
Okay. Yeah, Clara, I think she probably had to leave, so I'm going to present the poster again. I think the idea came from the fact that when I joined the team in Lewisham as a locum consultant, there was no departmental teaching for the juniors at that time coming off the pandemic. So we tried to introduce some educational aspect to the ward round, and without having a negative impact on the length of the ward round itself, and mostly regarding discharge planning and reviewing sickly patient in a timely manner. And we decided to introduce a coffee break mid ward run after we had promptly reviewed the sick patient from the night and the early discharges, and we decided to use as an example for discussion and interaction meeting some of the patients that were actually on the ward with us. So we picked topics such as hepatitis, viral hepatitis, alcoholic hepatitis, decompensated liver disease, upper GI bleed, so common gastroenterology cohort patient that we will have on the ward. And we sat down in the patient relative room, in the coffee room, and I normally made that very interactive. All the juniors, the registrar, were asking questions, so it was a very nice learning environment to try and also get a rest from the lengthy ward round. And overall, as you can see from the feedback provided by the juniors, it was very well received. They appreciate being taught, and also they appreciated the fact that they took very good tips and feedback on how to carry out the ward run on their own when the consultant or the registrar wasn't present, how to manage most of the common gastroenterology condition with our senior present, just because we were more empowered in how to look after them and know specifically when to involve the senior as required. Moving forward, I think this project hopefully will be carried on by future colleagues who are on the ward. At the moment, I'm on different duty at this moment in time, but my colleague who's on the ward now hopefully will be able to carry on this project forward. We noted there were some challenges around firstly, find the right space on the ward, which can be quite difficult. Not particularly we got moved from one area to another, and this new ward called Ward 3 didn't have a dedicated restroom for doctors and nurses, which would have been the ideal place to use to have a coffee break and discuss about interesting patient. So it was challenging at times. We had to relocate to different areas, sometimes use the garden space within the actual ward. So that was one of the difficult points. And but overall, it was a very well-received experience, and I hope that will be carried in the future. Part of the project for the future months will be to set up an afternoon board round to try and minimize duplication of work, trying to be more efficient in discharging patients home, and be more efficient in identifying an allied sick patient that needs to be reviewed sooner and rather than later. I will be moving to another trust soon in March. I hope to take with me the learning points of this project and perhaps expand it even further when I will be in Dartford as a substantive consultant, and I hope to be able to participate with NHS England and improvement in future work in the years to come. And I thank again Clara, all the rest of the team on the ward that helped me to put this little project together, and thank you for giving me the opportunity to present it this afternoon.
Fantastic, and we'd love to hear in the future how you've made it